We were raised in a household that was very loving and really focused on being neighborly and kind, and to give a little extra of yourself. Mom came from a big family, and there was 7 kids.
My father, he's very outgoing and always trying to get things done, or unless the Dodgers are on, then he's watching the Dodgers. Parents, they met at Paris High, got married, and it's been over 60 years.
The next 10 years after they got married was pretty much focused on having babies. They had 6 kids in 10 years. So imagine you're 30 years old and you've got 6 kids and trying to feed them. And
what a provider. We lived in Victorville. He commuted to Los Angeles. After so many years, he's working for one of the richest men in the world.
If you look at the success of my dad's career, there's no way that would have happened without my mom, because she was the foundation, that gave him the green light to go out there and do all the good things he wants to do for people and not worry about things at home because she's got it, right? And so to see that suddenly he's being honored, but she's also honored, for me is perfect.
Marion and Mary have been stalwart supporters of RUHS. And in addition to that, they really had a focus and affinity for making sure that we're providing quality health care to all residents of Riverside County, regardless of their ability to pay.
The Ashley's commitment to the hospital has been invaluable. I will dare to say that RUHS would not exist if it would not be in big part for the support of the Ashleys.
If you kind of look at the direction of the hospital and the support Marion has provided, that's been pretty consistent, both in good and bad times.
8 years ago, we were losing $1 million per week. There were a lot of voices that were not only expressing concern about that, but that were saying, we need to sell the hospital. Supervisor Ashley was a leader in saying, no, we're not selling the hospital. We're going to invest in turning the hospital around and making this the best hospital in the area to serve the community.
He was always optimistic. No matter what the subject was, he was optimistic they were going to get it approved, and he'd get it approved through the rest of the supervisors. If he gave you his word, he stood by it, and I listened to that, and I respect that.
His ability to stay focused and to be able to draw consensus within the Board of Supervisors has really helped us to kind of turn the hospital around, so to speak, and put us in a place now where RUH is really the model for other counties to be able to follow.
A lot of our members have spent time at the hospital, either through sickness, and some even work there. And so we've always had a fondness for that place and wanted to be able to do as much as we could as we succeeded over the years. Their commitment to healthcare in the county and our commitment, I think, is important.
Supervisor Ashley and Marion would not say, do what I preach, but not what I do. In the fact that they themselves would seek care in our hospital, it will trust their health care to our physicians, nurses, and our facility.
We were having a meeting, a staff meeting, and I didn't feel well during the meeting, and I finished the meeting, and I called over to the hospital and said, I don't feel well. Maybe I better come over to the emergency room. And so I went over to the emergency room, and Dr. Christened saw some things that he was concerned about, and we checked them out. And eventually I found out I needed a carotid artery operation, which I had here at the hospital. Very successful. That saved my life.
Being a patient here is wonderful. The nurses, the doctors are all just so kind and helpful. I've had 2 knee surgeries here, and the reason I had my surgeries here is because I was involved with the foundation.
As a founding member of the foundation board, Mary joined in 1989.
I mean, anytime you have anything named after you is a big deal. But to have it named after both of them, for me, I thought was awesome, because number one, I know my mom has been involved for 30 years on the foundation board of the hospital, and she's been very much involved in Festival of Trees, which, I mean, she was the pioneer of that idea. It's still going today.
Children touched my heart, and I was very glad that I was involved in the foundation, and actually when we started the Festival of Trees, that was our motto, for the love of a child, and a lot of our money does go to upgrade those units for children.
Education sometimes doesn't look to have an immediate return on investment, but there is a huge return on human investment in educating physicians, educating nurses, educating PAs, and others in healthcare. And thanks to their support, we have been for many years the most important educational hospital in Riverside County.
There was no one better to name this building after than Marion and Mary Ashley, because we're not only treating people, we're educating doctors and nurses to treat those people, and many of them are the less fortunate people. And Marion and Mary have always cared and thought first and foremost about the less fortunate. That's why it's so fitting to name this facility, this beautiful building, after Marion and Mary Ashley.
They are deep down great people. I mean, really good people, and they would never not help someone. If they had the opportunity to help someone, they would.
Because of the support that the Ashleys have given to the foundation, I don't think we would be at this place and at this point of time were it not for the Ashleys. While we're today celebrating the dedication of the building, I also think it's important that we take the time to look to ourselves to see what we can do individually and as a group to further the good work the Ashleys have done.